We know sometimes we can't relieve this suffering. Suffering's also been called extreme anguish, soul pain, or being less than full. That goes into this integrity piece. And importantly, we can't assume that there's any suffering. The only way to know if someone is suffering is actually to ask them about it. Because we know some people suffer when we would expect that there wasn't suffering there. We also know some people say they're not suffering when we would really expect that they would be. So in palliative care, we have this concept of total pain, easily understood as total suffering. And it's really that there are multiple parts of ourselves that can be the cause of suffering or where suffering is rooted. So this could be physical, mental, emotional, spiritual, social, relational. It can go on structural, environmental. But it really highlights the complex, multidimensional suffering. It's often not just rooted in one domain, but it's a combination of multiple factors. Um, and interestingly, if we think about all the things that affect our personhood, these are all the damage and loss and can be a cause of suffering. So some expressions of suffering. So we see that it might show up in the body as pain and the mind as I can't bear this. There might be loneliness, grief, rage in terms of our emotion, existential questions related to the spirit, spiritual nature of being alive. Why me? What does this mean? And then relational, social, this disconnection perhaps that happens, or this sense of being a burden. But what's not always obvious is the roots. Where does the suffering actually come from? Well, which is an important important question to ask. So there's common responses to suffering in the West. We typically see it as having no value and as something that should just be eliminated as fast as possible. And what we notice when someone's suffering is that their stress response is activated. So you'll see some different behaviors of fight, flight, freeze, faint, fawn. Um, I'm sure we've all experienced this type of reaction in ourselves and seen it in others. Those who can stay in sort of an affiliate system might go more to tend and befriend or abide and reside. That's certainly less common. We also notice that our attachment or our attunement styles get activated. So some people move toward others for help, maybe in a sort of grasping way. And some people retreat and are silent and don't ask for help or express their suffering. And those are often the people who are not seen as much in care and often need to be drawn out a little bit in order to understand their suffering more. And then there's this idea that we're actually coached and mentored and taught and trained into our response to suffering. And this could be in our personal lives. So we can think back into childhood. What did the adults around us teach us about how to be with suffering? What was the response? There's often, we can see a lot of the time, catastrophizing or an ignoring. And then in our professional lives, how are we taught to respond to suffering? So I can think back to my nursing education and thinking about the different teachers and mentors I had there about how to be with suffering when it shows up in a client. There are culturally normative responses to suffering, and this is largely driven by this value of it not having a value and not having importance, and also that it reflects something, often this idea that something's wrong and that someone's done something that's caused suffering. So there's something that they've made some sort of error that's maybe led to the suffering. And it's about seeking relief. So there's can be avoidance, distancing, denial, numbing, pleasure seeking. So this can be related to addictions. But again, couched in this understanding that it's all rooted in seeking relief from suffering.